I need to tell you something that most doctors will never bring up during a routine appointment. There is one single leaf, that clinical research has shown may help lower fasting blood sugar, reduce dangerous post-meal glucose spikes, and actively protect the arteries that carry blood to your heart and brain. You've probably walked past it hundreds of times. It might even be sitting in your kitchen right now. But here's what's shocking. Most seniors over 60 who are fighting blood sugar problems, prediabetes, or trying to protect their cardiovascular health have never once been told about this. Now, I'm not going to tell you what it is just yet, because before I do, you need to understand why this matters so much for your body specifically, and what is actually happening inside your bloodstream right now that makes this leaf so potentially life-changing for people over 60. I'm Dr. Sarah, and after 7 years specializing in geriatric medical problems, I have watched too many patients lose their independence, their mobility, and their quality of life, not because they weren't trying, not because they ignored their doctors, but because no one gave them the full picture. On this channel, we do things differently. We talk about 100% verified data, not opinions, not trends, not things someone read in a magazine, peer-reviewed research, real clinical studies, information you can download, read, and verify yourself. If that's the kind of channel you've been looking for, comment, "Yes, I do, Sarah," right now. Let me know you're here and that this matters to you. Let me ask you something honest. Have you ever done everything right? Taken your medication, watched what you eat, tried to move a little more, and still watched your blood sugar creep up? Still seen those numbers on your glucose monitor that just won't cooperate? If that's you, you are not failing. Your body is fighting a war on multiple fronts, and nobody gave you all the weapons. Here's what's actually happening after age 60. Your cells have gradually become less responsive to insulin. Your gut bacteria have shifted. Your body's ability to manage glucose after meals has weakened. Chronic low-level inflammation, the kind you can't feel, has started damaging the lining of your arteries. This is not your fault. This is biology, and the conventional approach, medication, restriction, monitoring, is absolutely necessary. But research is now telling us that certain plant compounds work at the cellular level in ways that complement everything else you're already doing. One particular leaf contains compounds that have been shown in clinical studies to slow glucose absorption, improve how your cells respond to insulin, lower harmful cholesterol, and reduce the arterial inflammation that leads to heart attack and stroke. And I'm going to tell you everything about it, how it works, the exact numbers from the research, and precisely how to use it. But first, I want you to understand why this is so urgent. And I'm going to tell you about 2 patients whose stories changed how I think about blood sugar management forever. If you or someone you love is managing blood sugar or worried about their heart health, comment, "Yes, I do, Sarah." So I know this information is reaching the people who need it most. Margaret was 71 years old when she first came to see me. She was active. She cooked her own meals. She took her metformin every day without fail. Her doctor had told her, "Your numbers are borderline, but you're doing fine." And she believed him. What nobody told Margaret was that borderline at 71 is not the same as borderline at 45. In a senior, consistently elevated fasting glucose, even in the 110 to 125 range, is silently doing damage. Every morning for 3 years, Margaret's blood sugar was waking up higher than it should have been. She noticed fatigue, but wrote it off as aging. She noticed her feet felt slightly numb sometimes, a tingling she described as pins and needles when I sit too long. Her doctor said it was circulation. He wasn't entirely wrong, but he wasn't asking the right questions either. Then one Tuesday morning, Margaret stood up from her kitchen chair after breakfast and felt a strange pressure in her chest. She sat back down. It passed. She didn't call anyone. The second time it happened, 3 weeks later, she was in the grocery store. This time it didn't pass. Her daughter drove her to the emergency room. What the cardiologist found shook her entire family. Margaret had significant narrowing in 2 of the arteries supplying blood to her heart. Her LDL cholesterol was elevated. Her inflammatory markers, specifically CRP, C-reactive protein, were nearly 3 times the healthy range. Her A1C, the 3-month blood sugar average, was 6.9%, not catastrophic, but high. Enough, long enough, to have been quietly damaging her arterial walls for years. The doctor told her family, "She's been in a slow, silent emergency for a long time." I want you to hear that. A slow, silent emergency. That is what uncontrolled or under-controlled blood sugar does to your arteries. It doesn't announce itself. There's no pain. There's no warning alarm. It just steadily, quietly destroys the flexible, clean lining of your blood vessels until one day, the damage is visible on a scan. Margaret survived. She had a procedure to open the blocked arteries. She recovered, but she lost months of her life to rehabilitation, lost her confidence behind the wheel for over a year, and spent every night for months wondering if she had pushed her heart too far. She asked me once, "Dr. Sarah, was there anything I could have done differently?" The honest answer was yes. Not instead of her medication, not instead of her doctor's care, but alongside it with better information, with specific evidence-based strategies, with the kind of knowledge we're going to talk about today. Margaret's story is not rare. It is the story of millions of seniors navigating blood sugar management without the full picture, which is exactly why I need you to keep watching, because what I'm about to share could genuinely change your trajectory. If Margaret's story resonates with you, if you feel like you might be missing part of the picture, comment, "Yes, I do, Sarah." I want to know this community is listening. The leaf I've been building toward is the mulberry leaf, not mulberry fruit, not mulberry extract in an expensive supplement. The actual dried leaf of the mulberry tree, Morus alba, which has been used in traditional medicine in Asia for over 1,000 years and which modern clinical research is now confirming has specific, measurable, evidence-based effects on blood sugar and vascular health. Let me walk you through exactly what's inside this leaf and why it matters for your body. Compound number 1, DNJ1, deoxynogermycin. This is the compound that makes mulberry leaves unlike almost anything else in the plant world. DJ is a natural alpha-glucosidase inhibitor. That is a technical phrase, so let me translate it into plain language. When you eat carbohydrates, bread, rice, fruit, anything with sugar, your digestive system uses enzymes called alpha-glucosidases to break those carbohydrates down into glucose that enters your bloodstream. The faster that breakdown happens, the sharper your blood sugar spike. DNJ blocks those enzymes. It slows them down. It essentially acts as a brake on how quickly glucose floods your bloodstream after a meal. In human clinical studies, mulberry leaf extract containing DNJ, taken before a high carbohydrate meal, reduced the peak rise in blood glucose by approximately 40% and reduced the peak insulin response by a similar amount. Think about what that means practically. A meal that would have spiked your blood sugar from 95 to 180 milligrams per deciliter might instead peak at around 140 or 145. That difference, day after day, meal after meal, is the difference between controlled blood sugar and progressive arterial damage. Compound number 2, fiber mulberry leaves contain significant dietary fiber, both soluble and insoluble. Soluble fiber slows glucose absorption from your digestive tract. It creates a physical barrier that makes glucose absorb more slowly and more evenly, preventing the sharp spikes that stress your blood vessels. Research consistently shows that adequate dietary fiber reduces the glycemic index of the foods eaten alongside it by up to 50% or more. That means the same meal, when paired with fiber-rich foods, produces a dramatically calmer blood sugar response. Soluble fiber also feeds the beneficial bacteria in your gut. And emerging research is showing that gut bacteria directly influence insulin sensitivity. A healthier gut microbiome may mean your cells respond better to insulin, even before you've changed anything else. Additionally, soluble fiber has been shown in multiple studies to reduce LDL, the harmful cholesterol, by approximately 10 to 12%. For Margaret and for millions of seniors with elevated cardiovascular risk, that is a meaningful number. Compound number 3. Powerful antioxidants, rutin, chlorogenic acid, and polyphenols. Mulberry leaves are rich in flavonoids and polyphenolic compounds. These function as what I like to call cellular defenders. Here's what they do. Inside your arteries, there is a delicate single-cell layer called the endothelium. This is the lining that determines whether your arteries remain flexible, smooth, and clear, or become stiff, inflamed, and prone to plaque buildup. Free radicals, unstable molecules produced by inflammation, poor blood sugar control, and normal metabolism, attack that endothelial lining constantly. The polyphenols in mulberry leaves neutralize those free radicals. They protect the endothelium. They reduce the chronic low-grade arterial inflammation that silently drives cardiovascular disease in seniors. Research on mulberry leaf's antioxidant compounds shows measurable reductions in oxidized LDL, the most dangerous form of cholesterol that contributes to plaque formation, and reductions in inflammatory markers like CRP. Compound number 4, magnesium. Mulberry leaves contain a meaningful concentration of magnesium, a mineral that is critically important for glucose metabolism, yet one of the most common deficiencies in people over 60. Magnesium helps your muscle cells absorb and utilize glucose more effectively. It supports hundreds of enzymatic reactions involved in energy metabolism. Research has shown that correcting magnesium deficiency can improve A1C levels by approximately 0.4 to 0.6 percentage points. That may sound small, but for someone at 6.8%, getting to 6.2% through a combination of strategies could mean the difference between a prediabetes diagnosis and a diabetes diagnosis. It matters. Magnesium also supports healthy heart rhythm, kidney function, and nerve signaling, all areas that seniors managing blood sugar need to protect. The organ level effects. Let me now connect all of this to your specific organs, because understanding this is what makes this information actionable. Your heart, the combination of D and J slowing glucose absorption, fiber reducing LDL, cholesterol, and polyphenols protecting the arterial endothelium creates a multi-pathway cardiovascular protective effect. Clinical research on mulberry leaf supplementation has shown measurable reductions in fasting blood glucose, A1C levels, and fasting insulin over 8 to 12 weeks of consistent use. It has also shown reductions in total cholesterol and LDL in studies involving people with elevated baseline glucose. For your heart, that translates to less glucose damage to artery walls, lower harmful cholesterol building up in those walls, and less inflammation driving plaque formation. Your kidneys, every point of blood sugar elevation above the healthy range puts additional strain on your kidneys' delicate filtering structures called nephrons. Over years, that strain leads to diabetic kidney disease, the #1 cause of kidney failure in the United States. By helping stabilize blood sugar and lower blood pressure-related stress through improved vascular function, mulberry leaf creates a protective environment for your kidneys. Your nervous system. The oxidative damage that drives diabetic neuropathy, the nerve damage that causes numbness, tingling, and pain in your feet and hands, is driven in part by free radicals attacking nerve tissue. The antioxidant compounds in mulberry leaves help neutralize that oxidative stress, providing a protective mechanism against the progression of nerve damage. If you're still with me and understanding how this works at the cellular level, comment, "Yes, I do, Sarah." I want to know this OG Sarah community is learning this information together. Robert was 68 when he came to me with A1C of 6.7% and fasting glucose that had been creeping up for 4 years. He was on no medication yet. His previous doctor had called it watch and wait, but Robert was watching the wrong things. He was watching his diet obsessively. He was counting carbs. He was walking 30 minutes every day. And still, every 3 months, his numbers edged higher. He was exhausted, not just physically, emotionally exhausted by the feeling that he was doing everything right and losing anyway. I sat down with Robert and I did something a lot of doctors don't do. I asked him what he was eating and drinking in the morning before breakfast and after dinner when he thought he was safe. That's when we found it. Robert had a habit of having a large bowl of white rice with his dinner every night. Something he genuinely didn't think of as dangerous because it wasn't a sweet food. He had no idea that white rice produces an almost identical blood sugar response to pure sugar, and every night his blood sugar was spiking hard, and then coming down only part way before he went to sleep, meaning his fasting glucose in the morning was elevated before he'd eaten a single thing. We made a plan together, not a dramatic overhaul, small, specific, evidence-based changes. We switched his evening rice to a smaller portion mixed with vegetables and a fiber source. We introduced mulberry leaf tea, specifically consumed 15 to 20 minutes before his largest meal of the day. We added a short 10-minute walk after dinner, not an hour, just 10 minutes, which research shows can reduce post-meal glucose by up to 20%. And we talked about magnesium. A blood test showed Robert had low normal magnesium, not deficient enough to flag on a standard panel, but low enough to be impacting his insulin sensitivity. We addressed that as well. At his 3-month follow-up, Robert's fasting glucose had dropped from 118 to 101 milligrams per deciliter. His A1C had come down from 6.7% to 6.1%. He had not changed his medication because he wasn't on any. He had not started a radical diet. He had made targeted, intelligent changes based on how his body actually works. He walked into my office and he said, "Dr. Sarah, I finally feel like I'm not losing anymore." That is what the right information does. It doesn't promise miracles. It doesn't replace your medication or your doctor, but it gives your body the specific support it needs at the cellular level to work more effectively. That is Robert's story, and it can be yours too. If Robert's story gives you hope, if you believe you can change your trajectory with the right information, comment, "Yes, I do, Sarah." You are part of this community, and this information is for you. How to use mulberry leaves, the practical protocol. Now, let's get practical, because knowing the science is only valuable if you know how to use it. Here are 3 specific, simple, evidence-based ways to incorporate mulberry leaves into your daily routine. Method 1. Classic mulberry leaf tea. Take 5 to 7 dried mulberry leaves. Pour approximately 500 milliliters, about 2 cups, of hot water over them. The water should be hot but not boiling, around 185 to 190 degrees Fahrenheit. Let it steep for 10 minutes until the water takes on a warm golden or earthy tone. Drink this 15 to 20 minutes before your largest meal of the day, typically lunch or dinner. This timing is important. You want the DNJ compound circulating before your meal begins, so it can inhibit the alpha glucosidase enzymes before they start breaking down your carbohydrates. Method 2, mulberry leaf and mint infusion. For this version, bring 500 milliliters of water to a gentle boil. Add 6 dried mulberry leaves and a small handful of fresh mint leaves. Reduce heat and let simmer gently for 8 minutes. Strain. Let cool to a comfortable drinking temperature and add the juice of half a lemon. The mint provides digestive support. The lemon adds vitamin C, which improves arterial wall elasticity and has been associated with reductions in fasting blood sugar in several studies. This version is particularly good for those who find plain mulberry tea slightly earthy in taste. Method 3. Mulberry vegetable broth. In 1 liter of water, combine 8 to 10 dried mulberry leaves, 2 cups of non-starchy vegetables, spinach, zucchini, or celery work well, and 1 teaspoon of turmeric. Simmer at low heat for 20 minutes, then strain. This broth can be sipped before dinner or used as a base for soups. The combination releases antioxidants and bioactive compounds together, and the turmeric adds additional anti-inflammatory benefit through curcumin. Dosing guidance research supports consuming approximately 250 to 500 milliliters of mulberry leaf tea or infusion per day, taken before meals for optimal glucose modulating effects. Start with the lower end, 250 milliliters once daily, for the first 2 weeks. This allows your digestive system to adapt. Important safety notes. Number 1, if you are on diabetes medication, particularly anything that lowers blood sugar, including metformin, glipizide, or insulin, monitor your blood sugar closely when you first add mulberry leaf to your routine. The combination may reduce your glucose more than expected. Inform your doctor. Number 2, excessive consumption can cause mild digestive discomfort in sensitive individuals, bloating, or loose stools. Stay within the recommended range. Number 3, if you have kidney disease or are pregnant, consult your healthcare provider before starting regular mulberry leaf use. Number 4, mulberry leaf is a supportive strategy, not a replacement. Continue your medications, continue working with your doctor, and bring this information to your next appointment. This isn't about going it alone. It's about being an informed, empowered patient who asks the right questions. I want to stop here for a moment and say something directly. There are channels on the internet that will sell you supplements, push miracle cures, and make promises that have no science behind them. That is not what we do here. Everything I have shared with you today is backed by published peer-reviewed research, clinical studies involving real patients with elevated glucose, real outcomes, real measurements. With this video, I am providing you with a full research PDF, a downloadable document that contains the studies referenced in this video. You can read them yourself. You can bring them to your doctor. You can verify every single claim. That is what it means to operate on 100% verified data. Your health is too important for anything less. If you believe you deserve real information, not hype, not sales pitches, but verified, science-backed education about your own health, comment, "Yes, I do, Sarah." Show me the Sarah community stands for that standard. Let me summarize what you learned today. First, mulberry leaves contain a unique compound called DNJ that inhibits the enzymes responsible for rapid glucose absorption, reducing post-meal blood sugar spikes by up to 40% in clinical studies. Second, the fiber in mulberry leaves slows glucose absorption, feeds beneficial gut bacteria, and can reduce LDL cholesterol by 10 to 12%, supporting both blood sugar control and cardiovascular protection simultaneously. Third, the polyphenols and antioxidants in mulberry leaves protect the arterial endothelium, reducing the oxidative damage and chronic inflammation that drive cardiovascular disease in seniors. Fourth, practical use is simple, affordable, and accessible. Mulberry leaf tea consumed 15 to 20 minutes before your largest meal in a daily dose of 250 to 500 milliliters with appropriate attention to your current medications. But remember, knowing is not enough. You need to act. Talk to your doctor. Download the research PDF linked in the description. Start with one small change. Monitor your numbers. Robert's fasting glucose dropped 17 points in 3 months, not from a miracle, from targeted, intelligent, consistent action. Your body is worth that investment. If this video gave you real, valuable information that could protect your health or help someone you love, comment, "Yes, I do Sarah," right now. It tells me this community is learning, growing, and taking their health seriously. And if you found this helpful, please share this video with one person in your life who is managing blood sugar or worried about their heart. One share could genuinely change someone's health trajectory. Subscribe to this channel because this is what we do here. Every single video, 100% verified, peer-reviewed, real information for your health. Bookmark this video. Come back to it before your next doctor's appointment. The research PDF is in the description. Download it, read it, bring it with you. Thank you for being part of the Sarah community. Thank you for watching all the way through. Take care of your health, take care of your family, and I will see you in the next video.